Hello, my name is Abby Ashbrook, and this is my presentation on my T601 scholarly project, The Importance of Prenatal Breastfeeding Education. I completed this project on the Labor and Delivery Unit at Hendricks Regional Health in Danville, Indiana, where I currently work as a labor and delivery nurse. And I could see a need for this project even before I was enrolled into this class. And I thought it would be something interesting and rewarding for me to explore and navigate through this semester. Anyone who is a parent or anyone who's been around a new parent can tell you that becoming a new parent is definitely not easy. There are many choices to navigate, and one of those important choices that new mothers especially will have to ask themselves is how are they going to feed their baby? Breastfeeding is an evidence-based practice that is best for the development and nutrition of an infant, and it is recommended exclusively from the first hour to the first 6 months of life. Breastfeeding offers numerous benefits for both the mother and the baby, including nutritional, psychological, social, immunological, environmental, and economic advantages. However, despite breast being best, there has been a global decline in breastfeeding rates. Although breastfeeding is supported on many international platforms, globally, only half of newborn babies are breastfed within the first hour. So with this assessment, I wanted to explore something simple that I could provide to my patients that would encourage them to want to breastfeed within that first hour and maintain that duration throughout their postpartum period. And the PICO question for this project is, in new mothers, does receiving prenatal breastfeeding education compared to not receiving prenatal breastfeeding education affect successful breastfeeding initiation and duration rates? And we'll explore that in the future slides. The relevance of this issue can be found pretty quickly when exploring different pieces of literature and peer-reviewed journal articles. There is a worldwide need for improved prenatal breastfeeding education. The recent global decline in breastfeeding rates can be attributed to inadequate prenatal education. Unfortunately, prenatal breastfeeding counseling is typically undervalued and insufficient for the needs of expecting mothers. These concerns are alarming and must be addressed to protect the health and well-being of moms and their babies. A study by Metten and Baltasi displays that increased rates of breastfeeding on a global scale could potentially prevent 823,000 annual child deaths and 20,000 maternal deaths due to breast cancer worldwide. Prenatal education is a vital step in preparing for birth and parenthood. The overall goal of this project is to identify ways to enhance current practices and make breastfeeding education more accessible, ultimately improving breastfeeding rates. So the 3 specific written objectives for this project include apply knowledge gained from breastfeeding education to build personal confidence with breastfeeding, prioritize breastfeeding goals and use prenatal breastfeeding education to achieve these goals successfully, and identify breastfeeding resources provided by the prenatal breastfeeding handouts. My previously completed literature review ultimately found prenatal breastfeeding education to be beneficial for achieving breastfeeding success. Knowledge deficits can be addressed through breastfeeding education, which encourages positive breastfeeding practices. Women who are educated before breastfeeding are more likely to initiate breastfeeding and continue for a longer period compared to women who did not participate in prenatal education. With this knowledge in mind, the desired outcomes for this project include increased patient knowledge and preparedness, increased maternal confidence, and improved breastfeeding rates. This includes initiation and duration rates. Throughout the duration of my literature review and exploring peer-reviewed journal articles, I found that it is actually recommended that prenatal counseling is happening at every single prenatal visit. And based on my patient interviews that I completed within my 75 direct contact hours for this project, every single one of my patients that I interviewed stated that breastfeeding was either not discussed at all prenatally with their physician or OB provider, or if it was discussed, simply the question was just asked whether or not they were going to breastfeed. But that was about the extent of the discussion of breastfeeding, and I found that a lot of patients were a little upset that this had been the case, especially if they were struggling with breastfeeding when it came time to the delivery process and early postpartum period. So my intervention for this project was to create some handouts that could be available prenatally, ideally one for each prenatal appointment. So roughly most patients who are not high risk receive about 10 prenatal appointments, sometimes less, sometimes more. So I met kind of in the middle and decided to create 10 handouts. And this content was for patients to kind of self-explore and use this as a basic knowledge of what they wanted their goals to be. Did they want to exclusively pump? Were they planning to try to breastfeed for a certain amount of time? Just some basic knowledge that is important knowledge for successful breastfeeding that would spark discussion with them and their OB provider. Also, I wanted them to be easy to read and something that would be easy to share with loved ones, whether it's a spouse, a partner, a friend, a family member who was going to be very present in the early days of their baby's life, and to support their goal of breastfeeding. With the more support that they have, the more likely they would be to accomplish their goals. And we have also had a big increase of patients in the last few years who are non-English speaking patients, and I wanted to create these handouts in various languages so that this was more accessible to patients that didn't just speak English. I noticed that too in my 75 hours, is that all of the patients that spoke a different language other than English, that this topic was just completely brushed over, and breastfeeding was usually not discussed. So our probably top 3 languages that we see at Hendrix are Spanish, Haitian Creole, and Punjabi, with a few other languages mixed in. So at a minimum, I wanted to implement these handouts into at least those 3 languages, and then more eventually moving forward. I had lots of different topics and ideas of what I wanted to use for these handouts, and some of them I could have gone really in depth on, but I wanted to narrow it down to what I thought would be the most important and would kind of get the most value, most bang for your buck in one handout, and what could be valuable for our patient population, and what would be essential to learn if they either hadn't breastfed before, or if they are a mother that's breastfed multiple children prior to this point. And I sat down and had a conversation with multiple nurses as well as our prenatal educator at Hendrix to kind of get some feedback from them as well of what they thought would be some important topics to include for these handouts. So the 10 topics that I landed on that were I felt essential for this project were hunger cues, increasing supply, postpartum nutrition for breastfeeding support, position and latch checklist, troubleshooting common anatomical concerns, keys to successful breastfeeding, waking your sleepy baby, is my baby getting enough, proper storage of breast milk, and over-the-counter medications and supplementations to avoid when breastfeeding. Here is one example of one of the handouts that I created for this intervention, and this one is the proper storage of breast milk. So this would be applicable for moms that are planning to pump, but this could also be useful for moms who are doing both breastfeeding and pumping. I also found in my literature review that one of the most common anxieties that new moms have when returning to work are simply how are they going to continue breastfeeding while they return to work. And in the United States, we live in a world where both parents are having to work, and not as many mothers are able to stay at home with their babies. So with this being a big source of anxiety for new moms, I wanted to touch on how to appropriately store breast milk, whether at home or at work or on the go. So this handout talks about how to store at room temperature, how to store at a refrigerated temp and frozen temp. I tried to keep it simple with bright, bold colors that would be easy to differentiate, and also have a little bit of a temperature gauge there for them to show what is recommended that they keep their breast milk stored at. Also, just for timeline wise, for example, I did not know that there's a difference between using a regular freezer and a deep freeze. So I personally learned a lot with creating these handouts, and that it's recommended that frozen breast milk is good for 3 months versus in a regular freezer versus 12 months using a deep freeze. And then on the back side of this handout, we talked about thawing, how to never thaw or warm breast milk in a microwave, and to never refreeze thawed milk, and then chilling milk on the go, because again, a lot of moms plan to eventually return back to work and will be pumping at work and taking their milk to and from. So I wanted to include some visuals to show how to use a little ice pack with a portable cooler, and to let kind of the moms know that they're not alone and that this is a pretty common thing that other moms are doing with pumping and coming back and forth from work. So this is just one example of the education handout, and I used the Lactation Education Resources website for the majority of my handouts. My plan for implementing these handouts would be both virtual as well as paper copies. So the virtual option, these handouts would be available through the OB Care Companion, which is a virtual access to prenatal education through Hendricks Regional Health. And the way that that is currently set up with other birth and pregnancy and labor related topics is at a certain point when the patient reaches a certain trimester or a certain gestational age in their pregnancy, they are automatically assigned prenatal education to cover, again, various topics. So I figured it would be great to kind of time these out with each prenatal appointment that they would have. And then if patients didn't have access to a smartphone or the MyChart app, we could print some copies, paper copies, and make those available at the OB offices. So this implementation would involve hospital leadership, the OB physicians, nurses, the prenatal educator, and the lactation department. And the timeline, dependent on hospital approval, hopefully implementation would be within 3 to 6 months of this presentation. But that would just be depending on many different variables. The desired outcome for my intervention would be increasing patient knowledge, confidence, and ultimately improving breastfeeding rates. This data could be collected through patient interviews and by tracking annual breastfeeding rates at the hospital. Currently, Hendricks Regional Health does track their breastfeeding rates, and it would be interesting to compare the data before and after my intervention. Ideally, a randomized controlled trial would be conducted to analyze the impact of this education on patient confidence, breastfeeding initiation rates, and breastfeeding duration. Patients participating in this study would be randomly selected and asked to complete surveys at their hospital discharge, as well as 3, 6, 9, and 12 months postpartum. The survey would assess their perceived confidence when they initiated breastfeeding, the duration of breastfeeding, their breastfeeding goals, concerns or struggles, as well as their strength. They would be asked whether the handouts helped them prepare to breastfeed or not. Thank you for listening to my presentation. This project was a great experience for me, and I am hopeful in the future to continue my work that I've done for this project and continue to promote prenatal education and breastfeeding success for my new moms that I'm taking care of. Thank you.